It's about time you got here. We've been waiting for you.
No, I had something to do. What are we learning about today?
Something about a new drug we gotta give. I can't remember the name of it.
I think it's called JuviSync or something.
JuviSync? That's not a drug. That's a dance.
Con los terroristas.
The Harlem Shake.
Yes, sir, I'm looking for them right now. Yes, sir, I understand. I'm going to get them to the ER as soon as possible. What are y'all doing in here? I just got off the phone with the doctor. I've been trying to get this new drug sheet out to y'all so y'all see what's going on this floor with this drug. Look, I don't know what's going on in here. I don't know if I really care what's going on in here. We just got to get this done because we have an influx of patients in the hospital right now. But do any of you want to explain it at all? You know what? It doesn't matter. We have patients to tend to. All right. There's a new drug out. You need to be very aware of it. It has some serious contraindications that people would not even realize when they were doing it, how it would interact with this drug. It's called JuviSync.
Guys, I told y'all it was JuviSync, not JuviShake.
You're the one who said it was JuviShake. What's the JuviShake, Kaylee?
That's what we were doing. We thought that's what you were teaching us today.
Do you want to expound on that? Do you want to show us what the JuviShake is, or do you want to learn about JuviSync for our patients?
Okay, we can learn about JuviSync. Gosh.
All right, let's get started so we can get down to the ER. The doctor is still paging me as we speak. Kaylee, what are the uses for JuviSync?
It's for type 2 diabetes and high cholesterol.
Tara, would you and David care to explain the implications?
You need to monitor their blood sugar and their serum cholesterol and triglycerides, and you need to monitor their liver function.
Okay.
And also observe for hypoglycemia and monitor for signs and symptoms of pancreatitis, severe abdominal pain, sweating, dizziness, contact your PCP.
Okay, Cassie, so what are some adverse reactions?
They could have irritability, the swelling of hands or legs, liver problems like yellowing of the skin or eyes, breathing problems, nausea, dizziness, erectile dysfunction, and poor memory.
Okay, on that note, Morgan, looks like the ball's in your field right now, so what would you tell your patient to be looking out for?
Well, first of all, you can't use it if you're pregnant. And the hardest one, I think, would be you have to limit your alcohol intake, so people can't drink as much.
They can't drink as much, or they can't drink at all?
It says limit, so we're going to go with just limiting.
I think there's one more thing that we need to cover, because this is on your everyday basis of a use, is that with an interaction with this drug, we might have patients coming in, and this is a major food interaction, that commonly are just eating grapefruit for breakfast, or with some juice with their breakfast or something like that. Grapefruit is a major interaction with this drug, and you're going to see some major adverse reactions. You're going to see some major issues going on with this patient if they have an intake of grapefruit, especially if they mix it with alcohol. So, now that we've got this out of the way, let's go tend to our patients in the ER. Put a little shake in it, getting it down there too. The doctor's still paging. Yes, sir. I have my team on the floor right now. We're assessing the situation. Yes, sir. Yes, sir. We're right on it. Yes, sir. Thank you.
Blue. All right, we found this lady at the local bar. I think she had a few drinks and fell.
How far along are you so we can get a doctor in here to have a look at you?
I'm not pregnant, I'm just fat.
I am so sorry. Let's get some let's get some oxygenation to her. Have you had any vomiting or anything like that, ma'am?
What are y'all doing?
No, to help your oxygen.
Ma'am, if you're going to be combative, we're going to have to restrain you.
Can I have another grape dragon, please?
What's a grape dragon again?
I already told you one time.
It has grapefruit juice in it.
What did you mix it with?
Vodka.
A lot of vodka?
3/4.
Nurse, did you say that she was on JuviSync?
Yes.
Looks like we have one of our adverse reactions.
Well, the patient's stabilized, so the doctor will be with you shortly. We're going to give her some time to sober up.